So I spend a fair amount of time telling people that most disc herniations don't require any sort of surgical intervention, and I will continue to stand by that, and the evidence supports my position on it. Most people will improve with time, with appropriate rehabilitation, gradually rebuilding their capacities. But for this video, I want to discuss a gentleman I've been working with for the last few months that absolutely surgery was the correct call for his disc herniation. And I want to go into telling both sides of this story because we need to be able to talk honestly about where the evidence points us. So he's 45 years old, very active guy, lifts heavy, goes hard in the gym, trains, golfs, travels quite a bit for work. So he's in a lot of flights, hotel rooms, things like that, helps coach his son's baseball team. He just doesn't like to sit still and be doing nothing. Last November, he started getting some really severe back pain, shooting into his left calf. He doesn't really have a particular incident that he points to, just, there could have been a number of things, but just started to really bother him and continuing to get worse. And so at first he's like, I'm going to wait this out, see how it gets better. So that's what most people are going to do in this situation, hoping it would just settle down, but it wouldn't. Did not get better. It started to get worse, started to become more difficult to walk. He started to feel like he couldn't lift his left foot. Went in to see his physician. The physician said, hey, let's get an MRI of this thing because of the radiating symptoms. And that's fine. This happens all the time. There was a disc herniation that showed up on the MRI, which was pretty expected. And, so far we're kind of telling similar stories. And we get into hundreds of patients, thousands of patients I've seen like this. But then there was a shift in how things progressed. So he was at the surgeon's office after the MRI. They were discussing, some choices he may have. And while he was sitting there talking with the surgeon, the pain all of a sudden started to get so severe in his back and down his leg that he passed out. He fell out of the chair and lost all control of his bladder all over the floor while he was laying there passed out in the doctor's office. And this changes the game immediately. Now we're talking about we need to get into surgery soon. We need to take some sort of compression off this nerve situation because we're losing bowel and bladder function. So the conversation at that moment isn't, well, let's give physical therapy another 6 weeks. It's, we need to address this now because we don't know how bad this is going to get. And that distinction matters more than anything. And, not all disc herniations are the same. And this turns out this is more uncommon than usual. So he had, they recommended a microdiscectomy. They wanted to do the best they could to preserve all the surrounding tissues and do the least amount of collateral damage with the procedure that they could. So they were just, we're not rebuilding a disc. We're just trying to remove whatever portions we can that seem to be compressing the nervous system and giving him all these symptoms. And sometimes this is exactly what we need to do. And if I'm going to point people towards a procedure in these situations, we need to explore the things that are going to be the least invasive, leave the least collateral tissue damage, because that gives you the best opportunity to get back to working on rehabilitating sooner. So, sometimes that's just what we need to do. And I just wanted to let everyone understand that I'm not like anti-surgery. I'm just anti-unnecessary surgery. And there's a big difference in that. So this is the part that gets fun. Because we see him after all this takes place. He gets cleared to start doing some work. And 6 months later now, he is golfing without issues, no symptom recurrence. He's back to training heavy. He's back to doing all his work travel. He's helping coach some baseball, getting back to living his life the way he was before. He does have an occasional symptom, and that's to be expected. Every now and then, he'll get a little zinger into that left calf. Every now and then, his low back will feel a little stiff and sore, but it's pretty mild, nothing unmanageable. And sometimes there's certain things that are going to be uncomfortable certain positions. And none of these things surprise me. And I made sure to reiterate that to him. None of this is surprising. This is exactly where you're supposed to be. This is exactly how symptoms in these situations are going to come and go, because healing and timing of healing isn't perfect. It doesn't follow a linear path. So most people will get into trouble is because they assume that they're going to have surgery and then they're never going to feel another symptom again. And then if they do feel a symptom, they say that the surgery didn't help. And that's an unrealistic view. Nerves are going to remain sensitive for months after these situations, years maybe even in certain positions. And the tissues around the area, because you had the injury that they were protecting against, and then you had the surgery, that there's going to be some stiffening that's going to go on for a while. And the brain remembers these things. And so it doesn't just mean that the surgery failed. And that's where most people get upset, is they don't understand why they still have some recurring symptoms after a procedure. And a lot of times they don't go back in and do the work necessary to help. So did nothing fancy. A lot of honest conversations, a lot of gradual exposure, a lot of rebuilding his confidence and his ability to move and use his back, and a lot of proving to him that every successful movement is that showing him that his spine isn't as fragile as that he had feared it would be moving forward. And that's how I like to rehabilitate. I'm not chasing some sort of perfection with people. I'm just trying to help them build capacity and remove their fear. So this case illustrates perfectly kind of both sides of this disc herniation discussion that I get into. Most people are not going to need surgery. That is absolutely true. Some people will need surgery. And the trick is knowing the difference. And that's where a skilled medical professional helps you out. Don't let people convince you that surgical intervention is always going to be the answer. And good medicine isn't about choosing sides. It's about choosing the right treatment for the right person at the right time. So today, he isn't defined by his MRI anymore. He isn't defined by the fact that he had a microdiscectomy. He isn't even defined by the symptoms that he still feels occasionally. He's defined by what he can do now, that he can get back to doing. And that's how I think rehabilitation in most instances should be measured in that way. Not whether every ache disappears, but whether the person is able to get back to their life. So sometimes surgery is going to be necessary, but we can't rely on it all the time. And good rehabilitation helps people restore their confidence, rebuild their capacities, remove their fear, and get them back to life.